Good evening, friends. My case is simple. Since I am presenting two cases today, tomorrow may be other cases. So first, this is the case of arteriovenous fistula with aneurysm of the upper branch of the right renal artery, and it was occluded with vascular plaque, amplarger vascular plaque. So 65-year-old female presented with symptoms of recurrent urinary tract infection and heaviness in the right flank. She was non-hypertensive, non-diabetic, and on clinical examination, there was systolic bruit present on the right flank, along with the pain. So she underwent ultrasound examination, which showed cystic mass in the upper pole of the kidney, which is a vascular mass, and therefore CT was done. We saw right upper renal artery aneurysm, which was calcified with AV fistula. So this is the CT scan showing this is the cystic mass calcified, and there is a dilatation of the venous channel suggestive of right upper renal artery aneurysm with fistula. So this is the angiogram. Just
big artery in general.
Yeah, it is well seen. So selectively hooked the branch which was giving the aneurysm, and then taken up in the second sitting, we took her for embolization by amplarger vascular plaque. Mm-hmm. And so this is a 4 French angiocatheter. Sorry.
Telephone, maybe the hospital.
4 French angiocatheter, selectively hooked with the hooked into the artery which was giving the aneurysm, and then this is the delivery sheet, 7 French delivery sheet, and amplarger delivery sheet, and this is the vascular plug deployed and then released. This is released, and over 24 hours time, this is a vascular plug, there is no fabric, so immediately you may not see the total blockage, but on follow-up, it is totally blocked. Yeah, this is the CT angio, so it is totally, this is the vascular plug, and the vascularity of the kidney was totally blocked. Done 24 hours later, same thing. This is a volume rendered image. So patient developed some pain in the right flank, which disappeared in 2 days' time without any bruit. Aneurysm with AV fistula of the renal artery can be selectively blocked by amplarger vascular plug if it is suitable like this. So this is the first case.
Thank you. I have a question for you.
Yes, sir.
Did you do this procedure by yourself or with a team?
Not able to, just repeat the question, sir.
Did you do the procedure yourself or with your team?
Yeah, with team.
And may I ask a question to Dr. Buckley? What would you have done to this case yourself? Cliff, you have an idea? Microphone for Dr. Buckley, please. Microphone. Because it's a megadolico artery. Ah, wait. Cliff.
I think the solution is a very unique one. I probably would have tried to put a short covered stent in to close the fistula and maintain the integrity of the artery if it can be done. I think his solution was excellent.
I think the painful flank came from a localized renal infarct.
Yeah.
Probably did.
But
it's usually painful like that.
Not going to do any harm.
Any comment from the floor regarding an alternative technique to this obstruction of artery with a plug?
Can I just ask you, I was not very clear. Was the AV fistula demonstrated very clearly?
Yeah.
Because on the...
This is not, I have only selected for PowerPoint presentation, so I have not, whatever it is, there was a fistula. Aneurysm, and then there is a fistula directly to the venous connection.
What are the angiogram, the first angiogram you showed?
Yeah.
there was no delayed phase taken, and I could not see the renal vein filling up because
This is because that time we selected this part. Previously we did the angio, we saw the fistula, but the aneurysmal part is so feeling much more early, and then the venous part is taking less, means it was feeling slightly delayed. That's why otherwise it is along with fistula.
Dr. Buckley, you have another comment?
The only other thing would be an open surgical repair of the lesion, which can be done by exposing it and just going in and reconstructing the artery, usually with a vein patch.
So do you have another case to present? Or
Yes.
is it finished?
No, another case.
So go on for the second case. You have 7 minutes. No, you have 4 minutes. No, look. 4 minutes.